Okay, let me share my screen again. I had a little bit of glitch there. Mm, like a lot is going on my screen that I'm to an extent of it. Okay, yeah, there it is. Can you see my screen now? Can everyone see my screen? Okay. Hi from Canada. Hi Nina, Grace, Canada. Ah, it's raining. Oh wow. Okay, great. Thank you so much for that feedback. That's my sound is great and my screen is great. So let's quickly get started because I hope for us to finish in like 30 minutes. Yes. Welcome to our first webinar. You may be wondering why I chose this topic, understanding depression. So why I chose this topic is because I spoke to quite a number of people, and they from the conversation you realize that they don't really know what depression is about, you know. And I thought, I think let's just start with the basics of understanding what depression is about, because if you know what you're going through, that is when you know the kind of help you're going to be needing, right? So what is depression? Oh, okay. So it involves a depressed mood or loss of pleasure or interest in activities for long periods of time. Now, the thing about depression is that you're not going to notice just one thing and pinpoint it to say, hey, this is the particular thing that is making me depressed at the moment. It's a complex, you know, it's a complex of different things going on at the same time. The social factors, the psychological factors, the biological factors. We will come to the things that contribute to people having depression. Okay. But the myths I want to debunk are these two things: that depression is not sadness. It's not, let me say, you wrote an exam and you didn't pass, and within that moment you're feeling so terrible about it, and then you throw the word casually, hey, I'm depressed. It's not enough. Or you went for a job interview and you were unsuccessful, and then you throw out the word, hey, I'm now depressed. Or that is, it's far from it. It's a mental health challenge. It's actually very serious, more than just your bouts of sadness or mood swing. It's actually a very, very serious issue. And there's something I saw on Facebook recently. Someone wrote, you are not depressed, you just don't have money. Like, what if you make money, all the depression and mental health challenges will go away? That's one misconception that people usually have. No, it is beyond money. It is beyond money. Yes, money will solve a lot of problems for you, but there are things that money may not be able to solve. So depression is not a poor man phenomenon. Okay. So now this is an interesting statistic. Let me move this away. Oh, okay. From the World Health Organization. Just pay attention that approximately 280 million people in the world have depression. Depression is about 50% more in women than men, and worldwide, more than 10% of pregnant women and women who have just given birth experience depression. This is just to give you an insight into how common it is. So it's not another phenomenon where somebody says, hey, I'm depressed, and you're like, leave that in a bag. No, no, it's not a leave that in a bag. It's actually that serious. And imagine that more than 700,000 people die due to suicide every year, with suicide being the fourth leading cause of death in 15 to 29-year-olds. So you can understand, this is just to give you an insight into how serious this thing we call depression is. And we live in an era where people don't take mental health challenges seriously. And then when the news comes up that, hey, someone died by suicide, the next thing you start hearing, everybody will start becoming a mental health advocate. Take care of your health, so take care of your mental health, so don't be depressed. So it's more common than that. It's not a one-off thing that social media triggers. It's much more common than that. Now, what are the common contributors to depression? Remember, we mentioned that depression is a complex of different factors. So these are certain things that can trigger it. let me move this away. I'll keep moving this so that you guys will see my screen very well. Okay. So these are the common contributors to depression. You have work-related stress. This one, during the stress management summit, if you filled the form, the registration form, there was a section where I asked, what's the common contributor to your stress? Majority mentioned work-related stress. So this was the number one thing on that list. So work-related stress can be due to different things. Okay, it could be due to the workload. It could be due to that toxic box, the toxic workplace, the colleagues, or commuting to work and coming back, or poor job satisfaction, not understanding your job description. So there are certain things that can contribute to work-related stress. And then we talk about marital issues. We hear about people that Japan, the next thing there is divorce in their marriages. These are the issues. These are things that contribute to poor mental health situations. Even why we call it a complex, let me give you an instance instead of just reading these things out, okay, which you can clearly see on the screen. So imagine you are let me see, you've had a plan, you've had a 10-year plan on what your future is going to be like. And then all of a sudden, you get a call that you're going to be terminated from your workplace. This is a workplace that you've used to plan for your future. And then because of that panic and uncertainties of what tomorrow holds, of course, you're going to feel low about it. You're going to feel terrible. Like, what am I going to do? That fear of unemployment And in addition to that, your spouse or your friend, that's your spouse due to the close relationship. Your spouse tells you, this marriage is not working on. I don't know. It's like, I'll have to go my own way or something like that. Imagine the pressure. You've not tackled what's going on in your workplace, and now marital pressure has added to it. Okay. And then the financial pressure, where your landlord is coming to ask you for the rent, and you know that your future is uncertain, you don't even have money saved somewhere, and now your spouse is calling for divorce in the marriage, and now you don't have money to even take care of basic needs. And oh my God, there are lots of things going on. And in addition to all of this, maybe you get a call that your beloved grandma or grandpa is now late. How can one person handle all of this? Or maybe even in the mix, you have a health challenge that requires you to go to the hospital to pay some medical bills. You see, even me that is talking about this hypothetical scenario is feeling so empathetic about whoever it is I'm even talking about, because it is too much for one person to handle. And when all these things are going on at the same time, what kind of thoughts will be going through the person's mind? You will start getting thoughts like, I don't think this life is worth living. Like, why am I even doing all this? Like, what's the point? And then it's even worse if the person doesn't have a social support. There are some people that, okay, maybe your circle of friends, if you call them now and tell them, hey, I need a place to rest my head, or I need 100,000 naira, and they will give it to you. But maybe this person I'm talking about don't even have such social support, or they don't even have the extended family to be there for them. So it's like the whole world is against this person. How do you think they are going to handle it? That is why some people are not that resilient enough, or they have pre-existing mental health issue that will make them think, what's the point? Let me just end it all. Then you start seeing someone looking for ways to die by suicide, to run away from the pain of everything that is going on. So these are certain things that can contribute to depression, abuse, relocation stress. This is not this japa that everyone is talking about. This japa that everyone is talking about, it's really a contributor to the stress of people. I was asked the other day, that was Punch newspaper. Yes, I did a contribution to an article on depression, soaring rates of depression among Africans that have immigrated to other countries like UK, Canada, USA. And yes, I contributed to that article, and I mentioned certain things that can make us make us to be at increased risk of depressive episodes. Things are simple, things like, let me not call them simple, things like isolation, leaving your family, leaving everybody you know, and going to a foreign land where the weather is different, the people are different, the language, what they speak, you have to listen carefully before you understand. To a new job, everything is just new. So that settling in phase can be really, really tough, especially when you don't have a social circle or you don't even know what you're doing at the moment, maybe lack of information or anything else. Even the weather itself can contribute because there's something called seasonal depression. It's not common where we come from. Let me say, like in Nigeria, where you don't really have those extreme weathers. But somewhere like the UK, where during winter you have daytime ending at about, that's from 3 p.m. It's beginning to get dark, and then by 8 a.m. that is when you start seeing daylight. So you start getting longer nights. So imagine somebody that is living alone and you're having such longer nights, no sunshine. It can be really, really challenging to one's mental health. The financial pressure, stigma, and isolation. In our climb, the African climb, stigma is one thing that we are still battling. Stigma of, look at this one. Before you know it, they call you a mad person. And if you mention anything mental health, the next thing you hear is that, that one is mad. Or it's like scoy, or something is touching his or her head. So we don't treat things like that the same way we treat physical health issues. Someone with a broken leg, people will be like, sorry, sorry. But somebody that says, I don't feel like it today, or I'm so stressed, or I feel depressed, or I've experienced burnout, they don't get the same empathy. They get what people usually get is a beg shift, or they isolate you. Isolate you like you're carrying one infective disease or the other. So this is more like an awareness for us to know that these things are common. Okay, these things are common, and for us to be more empathetic when people explain how they feel. And why this is more important is because we are very big on our faith as Africans. I think I mentioned this sometime. I've forgotten. Okay, and it was a different session. So we are very big on our faith, and our faith helps us to cope. Okay, and at the same time, when we start experiencing things that doesn't align with that peace, that joy, some people struggle to mention it, or some people struggle to show that vulnerability for fear of being judged. Hey, it's like this one is not praying enough. It's like this one is now a sinner. So for fear of being judged. So this is for us to know that some of these things have nothing to do with how you've prayed or how well you've not prayed. Because whether we like it or not, whether so long as we are existing on this earth, we are going to have seasons, different seasons of our lives. Okay. And there are certain seasons that come upon us unexpectedly. And it requires a little bit of adjustment for us to align with what that season is talking about. Okay. Because for instance, somebody that expects a new baby, if you're a first time mom, you've not done it before. So this transition is very new for you. So you're learning different things, and there are certain things that are going to overwhelm you. So this is not the time to tell the new mom, I beg, just pray and everything will be fine. The new mom, in addition to prayer, also needs as in practical tips or strategies to help them cope. Ample support, like enough support to help them cope through that season. All right. In addition to the prayers you're offering. So that's prayers with work. Okay. Societal pressure, health challenges, drug abuse. This era of social media. I beg you, don't let anybody pressure you. I've told you people that if you let somebody pressure you to and you now start having health challenges, when you start taking blood pressure medication, they will not take it with you. So you take it alone. Okay. Now let's quickly go to the symptoms of depression. Now these are things you should look out for. Okay. Common symptoms of depression, you have when I was in medical school, I don't know if this has changed. We are told that there are two core symptoms, which are the ones that are highlighted in the orange color, and then there are other symptoms. Now, what makes depression different from just the feeling of sadness you have is that the low mood has to be persistent for at least 2 weeks. At least that's for most of the day, if not every day. Okay, for at least 2 weeks. So it's not that your mood swing. Just go and find out why you're having mood swing and don't stress somebody. And then loss of pleasure or interest in activities. You find out that, oh, you're a social butterfly. Oh, you love to play certain music. Oh, you find joy in your hobby, in that sewing hobby, in football, but now you're no longer interested in it. In fact, you don't even want to interact with people. You just want to be on your own. You're struggling to concentrate. You're beginning to feel, why am I even living? Like, what's the point of existing? That feeling of guilt, that low self worth, hopelessness about the future. Like, there is no point, you know. And before you know it, you're starting to get thoughts. Maybe suicide is the way. And maybe you're sleeping more or you're sleeping less than usual. Either you're not eating any longer or you're now overeating to compensate, like comfort eating, and it's affecting your weight. You have low energy, low zeal, low interest to do anything. Even your job is beginning to be like a struggle for you. Your job that you used to be excited about is beginning, it has become a struggle for you. Even something as simple as showering, taking care of yourself, you're struggling with it because you're just not interested any longer. You're isolating yourself. People are giving you calls and you're just ending the call, or you're just ignoring their calls because you don't want any form of interaction anymore. And even as I'm sharing this, I know that you may have noticed it. It may not be you, maybe someone that you know. Okay, maybe someone you know, you may have noticed it in them. This is a sign. These are red flags that, hey, something is wrong and something has to be done about it. Please, if you notice this in a friend or anyone you know, please, 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 don't leave them alone. Don't leave them alone, okay? Don't leave them alone. And then we will talk about how that's the remedies for overcoming depression. Okay, let me move this. Remedies to overcome depression. So we'll do a little bit exercise. I don't know how we'll do this. Okay, that's okay. So when we talk about overcoming depression, it depends on the severity of depression. This is also another reason why you don't just throw the word around. And this is also an awareness to know how to support people. Okay. Now the first thing is this. Sorry. Just give me a minute. Okay. There is the mild, the moderate, and severe depression. Now, the treatments are different, or the remedies are different. So the person with mild depression, they will do well with therapy. Okay. But the person with moderate and severe depression, you are going to be introducing drugs to help them. Now, I'm not going to be going into the drugs or anything like that. Our focus is going to be on mild depression, since the rest of them is something you can get, you have to get from a qualified trained personnel. This one is not by drinking any herbal medications or anything like that. So how do you know, I know that that's the next thing you're asking, how do you know which kind of depression somebody may be going through? There is this questionnaire. I don't know if you can click on this link. Okay, let's do this then. Now, I've pulled out this questionnaire from an NHS website. NHS is the National Health Service here in the UK. So it's a questionnaire that is used globally, I believe. This because, yeah, I came across this questionnaire when I was in Qatar as well, and I've seen it, I think, Canada also. Now, this questionnaire helps the physician or the mental health professional to categorize the depression into mild, moderate, severe categories so that we'll know how best to help you, so that we'll know what sort of treatment or help that you're going to be needing. Okay, now these questions are basically the symptoms that I explained earlier. If you look at them, little interest or pleasure in doing things, number two, then you choose which one, whether it's several days, more than half the day, nearly every day, and then feeling down, depressed, or hopeless, you choose which one. I think I should just send this link to the WhatsApp for those that are in the WhatsApp community. Or if you're not there, you can just Google patient health questionnaire. It's out there online, so it's not a secret. Trouble falling asleep or staying asleep or sleeping too much, feeling tired or having little energy, poor appetite or overeating, feeling bad about yourself or that you are a failure or you have let yourself or your family down. I'm sure you may have noticed this kind of words from people where they feel that they've let their family down. Trouble concentrating on things such as reading the newspaper or watching television, moving or speaking so slowly that other people could have noticed. Or the opposite, you've become so fidgety and so restless that you have been moving around a lot more than usual, and then thoughts that you would be better off dead or of hurting yourself in some way. When I worked in accident and emergency departments, we got lots of people that were coming in with self-harm as a result of depression. Okay. So if you look at this questionnaire, it will help you, it will code the total for you, right? The person, and then sorry, right person know, yeah, which category. And then if you look further down, it says if you checked off any problems, how difficult have these problems made it for you to do your work, take care of things at home, or get along with other people. This is also another marker of severity. Sorry, give me a minute. Okay. So this is another marker of severity. Okay. And if you're going to use this questionnaire, once you notice a red flag, even if it's just mild depression, you're going to be needing to speak to someone. Please don't keep it to yourself, because the thing with these mental health issues, just look at it as a physical health issue. Let me say somebody that had a fall, that had a fall, yes, and then experienced a cut, and there was bleeding. Now, you didn't tackle that bleeding, like arresting it so that it will stop for that bleeding. Okay, you let it continue because you just ignored it. Now, before you know it, you've lost a lot of blood. That it is no longer the cut that you're dealing with. You're now dealing with the symptoms of low blood, like feeling faint, this persistent headache. You see, now the treatment is going to be more. So instead of the initial treatment where you just needed to tackle the bleeding, now you're going to be needing more treatment. Maybe we are going to give you fluid, or we are going to give you blood to replace what is lost. Okay, so look at it, use what I've just explained to relate it to the mental health side. Now, when you're stressed about something, you tackle it early, because if you don't, it progresses. This is how it keeps progressing. Now you know we have mild, moderate, and severe depression. If you don't tackle it when it's mild, it will progress. It will progress. Before you know it, we're talking about psychosis, like somebody that doesn't even have insight into what's going on in their lives. Right? So once you notice that something is off from this questionnaire, please say something. Say something, okay? This is how the depression severity scale is categorized. You can find this on the internet, okay? And then for the mild depression, I mentioned that yes, therapy is the go to. However, there are also self-help strategies, things that you can do to help yourself. Because when you go for therapy, yes, the therapist is going to support you. But then again, there has to be that motivation from you that you really need to get, that you really want to be helped. So these are certain things that can help you in the meantime, all right, to support you from things progressing to worse levels. Now, recognizing the sign, we've already talked about the symptoms and all the signs that shows that somebody is depressed. Do not isolate yourself. You know the interesting thing about therapy? All the things that your body is telling you to do, you're going to do the opposite of them. So your mind is telling you, Do not interact with anybody. Just stay off, stay on your own. But what will actually help you is going out there, getting that sunshine, going out there, being involved in community, being involved in volunteering services. So these are just things, little things that can uplift your mood, that can rewire things in your brain to help you to start feeling better. All right. So it's like, what's the best scenario I can use now? Okay, let's just move on. And the next one is exercising. Exercising is just like a holy grail. It's like, how do I explain exercise in a way that make you understand how powerful exercises are? Any opportunity you get. Now, this is for everyone, whether you're depressed or not. This is for everyone. Exercise is not that, hey, do it to lose weight. Exercise is just like a daily pill you need to uplift your mood, to boost your energy, to improve your mental well-being, to make your brain happy. Every lovely thing that you can think of, you cannot go wrong with exercise. And this is not that gym kind of thing where you do it and you get pains and you run away. As simple as walks. Just go out there and take a walk. Go out there. If you cycle, I don't know how to ride a bicycle. I'm ashamed to say it, but at my age, I don't know. But if you know how to ride a bicycle, take it. Go on a walk. Observe the things around you. This is not that mindless walk where you're going and yeah, you've even forgotten how you started and you've forgotten how you got to this next street. That's mindless walking. So mindful walking is being present in what you're doing, being present in noticing, oh, it's windy and I love how the wind is just blowing the sand and it's hitting my feet. That's if you're in a place that is sandy. I'm not, I'm just saying. Or how the wind is blowing the trees around you, or how, oh, look at the structure of this house, this is beautiful, how did they manage to put this kind of structure? So mindful exercise means you being present in the exercise you're doing, and by the time you're coming back home, you feel new. So this is something very, very practical, and I would really love us to do it as a challenge in the community. Yeah, it will definitely be one of the challenges in the community. Mindful exercise and manage your stress. Okay, that's why we say if you notice any issues, please tackle them early on. Do not allow things to linger. Do not allow things to linger. Okay, improve your sleep. Should I talk about sleep hygiene? In fact, the simple thing about sleep hygiene is try to limit screen time before you go to bed and make your room to be like a library. That's the best analogy I have about sleep, about good sleep. Make your room to be like a library. You know how you go to library and into a few pages, you're already feeling sleepy because there's a magic there. That magic there is most libraries you go to, their lights are not so bright like that. Okay, there are usually some dim corners, and then you find that the space, the way you're studying, is kind of private. And then the temperature, the temperature in that place is just cool, not too cold that it will make you shiver, and it's not warm that it will make you sweat. And it's so dead quiet, and it's so neat. So these are things that won't cost you anything, except the fact, yes, the temperature can be really, really warm back home. I know. But if you can see good for the other parts I mentioned, making your room to be that place where it is just for sleep. Unless you now have trouble sleeping, okay, then you are going to need someone to help you with improving your sleep. And then getting involved in your hobbies, you know that you're no longer interested in them. That means you're going to actively do the things that your body is working against. And there's another thing here, your mind. Your mind is telling you, hey, you can't do this. So your mind is telling you, hey, it's so worthless. But this is about you actively rewiring what your mind is telling you. So you can do this by journaling. For every negative thought you get, what is the other alternative, which is what is the positive that can replace it? Okay. it can be very, very challenging. I'll be honest with you. If you're alone, it can be very, 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 very difficult doing this alone. So if you have a trusted friend, maybe you're not able to get a professional, a therapist to speak to at the moment or urgently, you can just get a trusted friend and do this exercise with him or her. So this is a self-help service. This is a self-help activity to do. So if you are struggling, please speak to someone. Speak to someone. Don't keep it to yourself. You've seen what we talked about, the depression, the suicide rates. These things are actually very, very real. Very, very real. So if you're getting suicidal thoughts, please know you're not alone and please speak to a mental health professional. Please, I beg you. Life is worth living. Life is really worth living. Okay? And in conclusion, depression is not just those bouts of sadness or mood swings you get. If you notice any warning signs, please get help. Okay? And thank you very much. If you have any questions, I'll take them now. Okay, I'm going to the chat now to see. Oh, please share with us. I'm not sure what it was. I hope I shared whatever it was. Evel. Evel. It's an awesome name. Okay, no questions. Did you find this session helpful? Oh, please don't make me feel like I'm alone here. And yeah, we hit it 30 minutes mark because we started like 5 minutes late. Yeah, I'm so glad we didn't miss. Let me know. Let me know. Can I see your comments? Oh, very powerful. Thank you, Nina. It was helpful. Thank you. Thank you for the feedback. Okay, thank you for the feedback. So we are going to do if you're in the WhatsApp community, we are going to do a 5 days challenge on uplifting our mood. It's going to be interesting. It's going to be interesting. Okay, so if you're not in the community and you would love to join, you can send me an email and I'll send you the link to the community to join us on WhatsApp, where this challenge will be taking place. And if you have any topic you want to share, you want us to talk about in one of the webinars, in one of the monthly webinars, please send me a message. Okay, just let me know so I'll include it in the list. I want to share things that are really helpful to the community, not things that just come out of my brain, you know. Oh, thank you so much. Norma, that was so helpful. I felt you were talking to me personally. Thank you, Dr. Izine. Oh, thank you, Norma. Thank you, Joy. Dr. Grace, thank you so much. I really appreciate all your feedback and we'll continue in the community. See you all and have a lovely, lovely weekend. Bye.